like to take a moment and just welcome everyone to our today's session on diet, exercise, and breast cancer survivorship. We do encourage participation, and we would like to make you aware that we have the chat function available at the bottom of the screen. So if you have any comments regarding today's presentation, that would be a great place to put it. You're also going to find a link in there that you can go and sign up for more of our sessions and to learn what other webinars, breast education webinars that we have. There's also a Q&A function. So if you have any questions, please put those into the Q&A function, and we'll be happy to get to those at the end of our presentation today. Before we get started, I'd like to share a message from our compliance department. This content is not intended to be medical advice, and the viewer should consult their physician should they have any questions. The viewers should not rely on information contained in this presentation or webinar for immediate or urgent medical needs. Additionally, if you think you may have a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because of the information contained in this presentation or webinar. Today's session is Diet, Exercise, and Breast Cancer Survivorship. Our speakers today are Diane Riccardi and Jocelyn Blatchley. Diane Riccardi is a registered dietitian nutritionist in the breast program at Moffitt Cancer Center. She has spent 23 years specializing in oncology nutrition, educating patients on nutrition and health, promotion strategies during and after cancer treatments. Ms. Riccardi believes that health is one of the most valuable assets a person can have, and proper nutrition, along with exercise and stress management, is the foundation for a healthy body and disease prevention. Jocelyn Blatchley has been an occupational therapist for 11 years and has worked at Moffitt McKinley Breast Clinic for the last 5 years. She graduated from University of Florida with a Bachelor's of Health Science and graduated from the New York University with a Master's in Occupational Therapy. She specializes in lymphedema and breast cancer rehab on the second floor at Moffitt McKinley, as well as the multidisciplinary surgical lymphedema clinic alongside Diane. Thank you both for providing today's session, and you can begin.
Thank you for having us today. We're excited to be talking to our patients today and our team members about what's near and dear to our heart, which is diet and lifestyle and breast cancer and how to take charge of your survivorship. So we've known for many years that lifestyle is very impactful in whether or not we develop cancer. But what we're finding more and more is that some of those same healthy lifestyle behaviors can also help us prevent a recurrence or a new cancer from developing, and obviously help us live a very healthy life after our cancer diagnosis. So I'm going to start, and then Jocelyn's going to take over after we talk about nutrition. So what do we know about the impact of a healthy lifestyle on breast cancer survivorship? Well, we have so many breast cancer survivors now, which is amazing news. We're catching breast cancers earlier. We've got better treatments for breast cancer, and more women are living long, healthy lives after a breast cancer diagnosis. And we want to help them to do that and improve the quality of that life. And what we can do is, what we're going to start to do is talk about what's really an optimal diet for breast cancer. A lot of times people will ask, well, what can I do next? What's the next step in the cancer journey? And how do I get started? And then Jocelyn's going to cover why physical activity is really so important and how to make it part of your everyday life if it isn't already. So cancer cells are like weeds in a garden. So I like to think about this visual in trying to explain how nutrition and exercise and good sleep habits and stress reduction, not smoking, how all these are impactful in whether or not a cancer recurs or a cancer occurs in the first place. Sometimes the soil, right, can allow weeds to grow and spread. And soon your entire garden would suffer as your plants kind of compete for space and nutrients. So what your your oncologist is working to do is remove the weeds as much as possible. So a weeds comes up, it's a cancer cell, and they're going to remove it for you. But really adopting a healthy lifestyle after that, and is like adding weed control fertilizer to the soil. So what it does is it enriches the garden and it's improving your body's health and hopefully preventing any other weeds or cancer cells from coming up. So what is the science? Unfortunately, there is a lot of information on the internet that is not based on science. So what we'd like to provide for you here is science-based recommendations. And we can touch on and talk about other things that are out there on the web, but we really want to just stay and focus on the things that we know are going to be so impactful in your recovery. So we follow guidelines from the World Cancer Research Fund and the American Institute for Cancer Research. They're really the leading authorities on the link between cancer, diet, lifestyle, and exercise. And their vision is really a world where no one develops a preventable cancer. So this was their landmark third report, and it's how diet, nutrition, and physical activity affect breast cancer survivors. So this is specifically data collected on women and men who are living with breast cancer. And what they do is they looked at all the research from all over the world on not only preventing cancer, but really on surviving cancer. And they call this the CUP, Continuously Updating Project. So data is continually added to this, and then a new report will come in. But as far as what we know right now, where the evidence is showing that the longer we can survive after a breast cancer diagnosis really has to do with a few things. One is being at a healthy weight. So if we're not at a healthy weight, or if we gain weight on treatment, which is fairly common, really getting to a healthier weight in your survivorship is recommended. You can do that by being physically active, and there's some data, very good data, that's showing that physical activity after a breast cancer diagnosis can improve survival, even if it does not lead to a weight loss. Eating foods that are high in fiber, there's a lot of research showing about the benefits of these plant chemicals in fighting cancer in your body and preventing it from occurring. Eating soy foods that may be different from what you heard initially, or if you were diagnosed a long time ago. We do know that soy foods are not only safe, but are potentially beneficial for breast cancer survivors. And then, of course, eating diets that are low in saturated fat. And that would be mostly coming from animal protein. So they want you to eat more fish, etc. So if you kind of look at what the diet recommendations are showing, where we're going to focus first, this is really a plant-forward diet, or it's a plant-based diet. So we're asking you to eat less meat. So here are our survivor guidelines. So being at a healthy weight and avoiding weight gain in adult life. So unfortunately, what happens in America is every 10 years or every decade, we are gaining a little bit more weight, and we're not losing weight, and we're not exercising. So what we're noticing is as the decades go by, we're becoming more sedentary. So not only are we not doing purposeful physical activity, but we have a lot of desk jobs, and that's causing us to gain weight at the same time. So that's why the average American now is overweight. So how strong is the link between being overweight and breast cancer outcomes? So it's pretty strong. So obesity, being overweight at the time of diagnosis, people are more likely to have a cancer recur or develop a secondary cancer, or risk of death or mortality from their cancer. So this has been an area that dietitians really want to target, because unfortunately, a lot of the breast cancer treatments are contributing to weight gain. So you may have gained weight even during your treatment, and then after that, we're asking you to lose weight. So it can be very frustrating, I know, for a lot of women who have gone through breast cancer treatment or taking anti-estrogen therapies, who's one of the side effects may be weight gain. That can be really frustrating. So there is actually a clinical trial where they've completed the trial enrollment. So it's called Breast Cancer Weight Loss Study, BWEL. And what they've done is they've recruited women and they've randomized them into a weight loss group and a non-weight loss group, or meaning a group that's not getting dietitian interventions. And they're only about a year or so into the trial, but what they're finding so far is that the good news is that the intervention group is losing weight. So if you're wondering, is it possible to lose weight after a breast cancer diagnosis? It is. They've proven it, they've shown it. So the women are losing weight. Now, whether or not it's going to impact their long-term survival, unfortunately, we have to wait years to see that outcome. But we're hoping that in maybe 4 or 5 years that we're going to start to see a difference in the two groups. And we're hoping that the group is losing weight will actually have less of a risk for their breast cancer recurring. So waiting to hear more on the results of that study. So as we just said, nearly half of Americans are now overweight, but we believe by the year 2030 that more than nearly half of Americans will be obese. So unfortunately, that number is kind of growing. And this is just a representative of what's been going on in different states. And you can see Florida is in that kind of 40 to 49%, rate at the moment. So really, obesity is being described as the new tobacco for our generation. And we're looking at weight loss strategies as being one of the major players in preventing breast cancer and breast cancer recurrence. So how do you do it? So there's currently no one specific style of diet that's been found to be more beneficial for weight loss. They've kind of done the low carb versus low fat kind of head to head. And for some people are losing weight. For other people, they're not losing weight. So the same style may not fit you if you're looking to lose weight, but we try to always bring it back to, well, what would you be eating or what would you be doing that's going to be fighting cancer? And if we can do that and lose weight, now we're doing two things that are really beneficial to your health. So we kind of talked about eating more plants. Definitely plants are more fibers, they're more dense. And if you put them on half your plate, they're going to take more room and provide a lower calorie source. So you are going to eat less calories if you have more plants on your plate. Avoiding foods with added sugars. America is now the leading country. We get to take this claim for being the leading country that consumes the most sugar, has the highest sugar intake, unfortunately. And a lot of that's coming from added sugars and high fructose corn syrup, etc. We're also eating larger portions than we have ever eaten in our lives. So even kid-size ice creams are 12 ounces, which is much too big for a child. A portion size of ice cream should be 4 to 8 ounces, not 12 ounces. And of course, being physically active has been proven to help us once we're starting to lose weight to kind of maintain that weight loss and keep our muscle strength. So how to eat more plants? I usually say one plate at a time. You could just pick one of your meals. Maybe your dinner meal is where you're going to be able to get most of your vegetables in. So if you start all the way on the left with the standard American diet, this would be very typical. Me growing up, this was a very common plate that I would see when I was growing up. So you would see about half the portion is meat. That's really takes the prime real estate. And then a lot of starchy vegetables, maybe corn, peas would be there. Of course, some other type of starch like potatoes, a slab of butter on that to add flavor. Well, if that's where you are, it's okay. So try to move to the next plate where you're bringing the meat portion down to about now maybe a fourth of the plate or a little bit smaller. A size of deck of cards would be great. And then you could substitute out. You can move the potatoes it could be rice, but it could still be potatoes, but a smaller portion. Try and bring in more of those green vegetables. If you're there, you want to move to the next plate. Now we're starting to see a lot of color. If you look at your plate, you see a lot of color, you know you're eating mostly plants because that's what's giving us that beautiful color. And those different colors are all fighting cancer in a different way. So you want to see a very colorful plate. And here you're starting to see almost half the plate now is going to be your vegetables. And then if you're already here, can you take it a step further? You could stay there because that's a beautiful plate, or maybe you want to bring it a little bit further and you're going to do more of a bowl. Now you're really bringing your animal portion down so that your chicken is maybe now only 2 ounces. That's kind of sprinkled on top for a little bit of flavor. You could use a brown rice. So there's all different ways of cooking the same foods and the same meals, but having your plate look a little bit different. A lot of people will say, well, you know, my kids aren't going to eat this way, or my husband's not going to eat this way. And I say, it's okay. You can be eating the three of the same foods or 4 of the same foods, but your plate's going to just look a little bit different. Makes it a lot more doable for people. Okay, so whole foods. So we eat a lot of refined foods. A lot of our foods are refined. We start with a strawberry and we end up with a whole fresh strawberry, and we end up with a strawberry roll or strawberry jam. So we are really processing our foods quite a bit. And that's really contributing to weight gain also. So if you think about kind of the classic Mediterranean diet, it's a lot of fresh food, it's a lot of whole food. So when you're eating and choosing these plants, try to choose them as close to the way they come out of the ground. You know, rather than going for a canned vegetable, can you go for a fresh vegetable? If you don't see a fresh vegetable you like, can you buy it frozen where it's picked fresh and flash frozen with no sauce? Those are still very nutritious. So try to stay to the whole foods as much as possible. So what's going on with our sugar consumption? I just said that Americans are consuming more sugar than any other country. And really sugary drinks are really the key driver in where we're getting our added sugars from. It's coming from other foods and things, but the sugary drinks are providing the most calories. And unfortunately in America, sugary drinks are sweetened with high fructose corn syrup. Not as many are sweetened with table sugar. Now, the body doesn't always know the difference, but the liver knows the difference. So high fructose corn syrup is really harmful for the liver, and we're seeing kind of an increase in fatty liver and fatty liver disease, non-alcohol related. So if you can do anything, or if you want to start somewhere today and kind of bringing your calorie intake down or bringing your sugar intake down, start to look at your beverages. Are you drinking your calories? And if you are, all we're asking is just reduce that in half. Just take it down in half. If you're doing 2 tablespoons, can you bring it down to 1 tablespoon? If you're doing soda or you're doing juices, even they're very sweet, very sugary, even natural juices have a lot of sugar in them. Can you dilute them kind of half and half? Just try and bring it down. Do that for a couple weeks until you're now more accustomed to drinking something that's not as sweet. And it will take 2 or 3 weeks to get there, but you can definitely get there and just start weaning down in your sugar intake. So how do you know how much added sugar is in a product? So they're calling this the new and improved nutrition facts label, but it's in fact been out for about 2 years now. So what you're seeing is a much better label. Is it perfect? No, dietitians would probably want a few more changes in there, but I think the government is moving in the right direction. So a few things you're going to notice from what was the old label to the new label is the calories are really big now. You don't have to go searching for that 230 calories on the left-hand side. Calories are much bigger. And remember, the calories are always representative of what the serving size is. So if you're drinking the entire Coke, the 12 ounces of Coke, and your serving size is saying 6 ounces, so you know you have to double that. So you really have to look to see, am I eating the amount of serving that they're calling 1 serving size, so that you know how many calories you're taking. But what's really fascinating and what we're really, really happy to see is that not only you used to see total sugars under carbohydrates, and now you're seeing how much sugar is added to the product. So for example, yogurts. Many yogurts have sugar added to them. So you can buy a vanilla yogurt that maybe has 1 teaspoon of sugar added to it for that vanilla flavoring. And another vanilla yogurt from a different manufacturer will have 4 teaspoons of sugar added. So you're going to see a big difference, but you can easily just pick up a nutrition facts label, look on the back, see how much sugar is being added to the product, and try and really get as close to 0 as possible. They're not going to tell you teaspoons, unfortunately, but they will tell you grams. And you can do a little bit of math. I mean, you can just look for a lower number, or if you really want to know how many teaspoons is in it, you can take the number, like in this case, 10 grams, you could just divide it by 4. And you could say, oh, okay, well, that's like 2.5 teaspoons of sugar. It's a really good visual and trying to imagine how much sugar was added to something. You can imagine sodas and things are going to have over 10, 15 teaspoons of sugar. So portion sizes, all right, so they're bigger than they normally are. So you could just go out and start eating half of things. But you can also use your fists. You always have this kind of hand as your guide to estimate portions that will satisfy and help you reach your goals. So the size of a fist, if you made a fist, would be 1 serving size of a whole grain. A flat hand would be your non-starchy vegetables. So imagine that be half your plate. 2 flat hands side by side is how big your plate should be. If you look at that right now, your plates at home are probably bigger than that. So you want to maybe try to find some salad plates or plates that are a little bit smaller. But basically, you can use your hand to kind of estimate your portion sizes to see if you're eating kind of what would be a recommended portion size. Remember, the healthy foods can sometimes be served in large portions. So you go out and you have a healthy smoothie and you're like, I'm getting all my fruits and vegetables. And then you realize that it's 300 calories that you're drinking. So yogurts, when you get frozen yogurt, there's never a small carton. It's always the big carton. And then, of course, you're going to fill that big carton. So that's going to really add up to calories. Olive oil is healthy for you. But if you're eating 3 tablespoons, that's 300 calories. So you want to use even healthy foods kind of sparingly. So we do have a program that we're calling SOAR. We've named SOAR, Survivors Overcoming and Achieving Resiliency. So this is for if you've had breast cancer and you've completed your active treatment. So if you've completed chemotherapy, whether you had to have radiation or not, your surgery is completed. We do run this program twice a year, in the spring and in the fall. If you're interested in the program, just let your caregiver, your Moffitt healthcare provider know. If you're a Moffitt patient, you're eligible. It's a free program. And we're doing some exciting things. We're kind of trying to address needs that people have as they're transferring into survivorship mode, meaning they finish their active treatment and they really want to start doing some of these healthy behaviors. So this program's available to you. And what we're doing a lot with the program now is we're doing a teaching kitchen. So it's all completely virtual program. So if you live 2 hours from the cancer center, it's fine. But what we're doing with the program now is you're going to be cooking. And we're trying to get people back to their kitchens and eating some of those whole foods and preparing meals similar to the ones that we just looked at. So what about physical activity? I'm going to kind of roll in so that Jocelyn can take over. But being physically active, unfortunately, we know that Americans do not get enough physical activity, and breast cancer survivors are really no different than the typical American. Even though we know how important it is, Jocelyn's really going to kind of help us today to kind of get started if we're not already exercising. And just a little shout out that, the Miles for Moffitt is coming up on November 18th. So if you there, and there's all different options, you can kind of walk, there's a run, a really great opportunity for you to be with other survivors. So thank you very much. And I'm going to turn over now to Jocelyn.
Thank you, Diane. As always, you do such a great job of explaining it in a way we can all see and understand so easily. So thank you. It is my kind of pleasure to go over some of these guidelines with you, talking about what has been proven in the evidence for cancer survivorship, and how we exercise, how frequently we exercise, and how that impacts us going forward. So we know that exercise plays a vital role in cancer prevention, but how do we start and how do we maintain our exercise after we've gone through such a hard journey with treatment? And like Diane kind of talked about, the things that can happen with anti-estrogen therapies, such as weight gain, fatigue, joint pain, that can have such an impact on our exercise, that we may be exercising differently than we have in the past. So our guidelines always state that a patient should be as physically active as their abilities and conditions allow. So it's not a one-stop shop, but we can go over what the evidence states in preventing cancer reoccurrence to give you some baseline kind of benchmarks to shoot for. So what are the guidelines that have been proven to help the most? So 150 minutes of moderate intensity or 75 minutes of vigorous intensity exercise per week. So that comes down to, I like to think of it as 30 minutes, 5 times a week of a nice power walk through your neighborhood. It could be a swim, it could be hopping on a stationary bike or an elliptical, anything that you have at your disposal. But the number one way to get active is just to get out and walk if you can. That is a great place to start, even if you can't add these extra touches to it. Trying to shoot for a 30-minute walk 5 times a week has been proven to be the most helpful way to get started. Then we try to add a little bit more to that. So strength training 2 to 3 times a week. Can start off with just body weight exercises, but then eventually maybe adding some bands and weights to that if you're able to and your body allows you to. And then we always recommend flexibility exercises. I usually tell people, especially after radiation, following radiation the first year, we really should be stretching every single day, those upper body muscles, to help prevent some of the tightness that can occur. This is something that has been proven to be helpful just for overall function and being able to complete things like our activities of daily living. But exercise programs should be adapted for the individual survivor, right? So that's why we do have things like SOAR, that program that Diane talked about. We have rehab here that can kind of come up with an exercise program for you that maybe you're having trouble completing some of these benchmarks, but you want to start somewhere. It can be something that you come and see us in rehab and we can help you create that. We do also have some structured exercise programs that I'm going to talk about a little bit later. So that would be a great place to start. We always want to make sure that if you are going to be exercising on your own, you want to be with a fitness professional that understands some of the things that happen after cancer. So things like increased risk of fractures, cardiovascular events due to chemotherapies, potential neuropathies, right? That numbness and tingling that can happen after chemotherapy can really have an impact on how much we're walking and how much we're able to exercise. So you want to be with someone, if you're getting a program online or, maybe you have a trainer, maybe you are just doing some YouTube videos, you want to make sure you're checking out who you're exercising with, making sure they understand some of the common things that can happen after cancer. Really what we try to talk about the most in rehab is trying to maintain and increase muscular skeletal mass. That is something that we can check in our clinic with our bioimpedance machine that is able to read your muscle mass based on the normal population. And we can create goals for you to try to increase that slowly through exercise. So some good places to start are the Rocky Mountain Cancer Rehab Institute program with the link right there. And also Rehab Systems has a great program as well. Those can sometimes have a fee, but they're great places to get some good basic knowledge on how to start an exercise program. Another couple of good programs are going to be the Live Strong at the YMCA. It's a free program. You get a free YMCA membership with your kind of participation in the program, which is a great tool to have to start that journey. You do have trained professionals who help you kind of start that process of getting back into exercise. And it's a really great way to get kind of meet other people in the community who are going through similar things. and to just kind of jumpstart that exercise program that you've been meaning to start. Another good program is the Maple Tree Alliance. It does have a fee involved, but it's online and is just a great personalized program to have at your disposal to start exercising at home. So just kind of segueing into lymphedema, because that is kind of my bread and butter. I'm a lymphedema therapist here at Moffitt. So I'm treating lymphedema and talking about lymphedema prevention all day long, every day. And so the guidelines basically state that exercise is a healthy part of preventing lymphedema. So it used to be in the past that we would tell patients not to move and not to lift a certain amount after surgery to prevent lymphedema from happening, but that has kind of been disproven in the research. It is good to not only start exercise, but make it a part of your daily routine as part of your lymphedema prevention kind of plan that you may have with your certified lymphedema therapist. And obviously, if you do have lymphedema, we still want you exercising, but it is good to consult a certified lymphedema therapist and coming up with an exercise plan that may work for you, which might include things like wearing a compression sleeve. It may include modifying activities, but it is something that we can go over in the clinic if it is something that you are suffering from. So just reaching out to us, we are happy to help you try to figure out a plan that works for you. But individuals with or at risk for lymphedema should perform aerobic and resistance exercises in a safe manner. It's not been proven to be a trigger for lymphedema. So just again, to kind of go over, if you have lymphedema, you may have to modify what you're doing to avoid sometimes a little bit of extra fluid that can come with, participating in certain exercises. And that's different for everyone. But things like allowing adequate rest intervals between sets, avoiding weights that wrap tightly around an extremity. We always usually recommend wearing a compression sleeve if you have lymphedema and you're exercising. Things like maintaining hydration, avoiding extreme heat, and just working different body parts at different times are things that you may have to incorporate into activities if lymphedema is present. Another big symptom that we see a lot is fatigue. So fatigue is one of the most common side effects of cancer treatment, and it can be caused by all sorts of different modalities that a lot of you have unfortunately had to endure as part of your cancer treatment. But cancer treatment related fatigue is usually not relieved by sleep. So that is something that is kind of a misconception, that the more that we rest, the more, the less the fatigue will impact us in our everyday. But it's always good to talk to your doctor first to make sure you are both on the same page of where your fatigue is coming from. But one of the most kind of recent big studies that have come out is how much exercise can decrease some of the cancer-related fatigue that can happen after treatment. So not only is it kind of counterintuitive, we would think rest would help more than exercise, but multiple clinical studies have been done showing the importance of exercise and decreasing the amount of fatigue that we have. So if this is something that you've been experiencing, it might be good to talk to your doctor and talk about how exercise can help some cancer-related fatigue that can happen after treatment. Another thing we've talked about too is that chemotherapy-induced peripheral neuropathy. So if you're experiencing pins and needles, different sensations on your hands and feet, it can impact things like fine motor tasks, completing your basic dressing, bathing tasks, can impact your ability to walk. These are things that we can work on in our rehab clinic here. Things like working on balance, strength, range of motion, all of these things that our trained therapists are kind of working on every day with people to try to help them and assist them in making sure that peripheral neuropathy does not impact the ability to exercise. This is a beautiful picture of great posture, right? So a lot of the times after and we tend to start to slouch, and our pectoralis muscles tend to come forward, our trap muscles tend to lengthen, and we start getting that forward shoulder that can happen and cause tightness and pain in the region where you might have had treatment. So if you cannot, all of a sudden start walking 5 times a week, a place to start would be just sitting up straight and breathing. Anyone can participate in that. So it can be done laying down, sitting, standing. Just try to strengthen straighten your back muscles and focus on breathing. Imagining your ribs are a parachute. As you inhale, breathe the air up into your ribs and try to open that parachute. And then as you exhale, imagine there's a balloon under your ribs, and you will pop the balloon by squeezing your ribs in and down. So just working on deep breathing can sometimes be a great core exercise. So when people ask, where do I begin with exercise? Just breathing and working on posture can be a great place to start that journey of exercise and getting back into it. We talked about the importance of walking, but here are some good tips on starting a daily walking program. So things like wearing a good pair of shoes, finding a soft, even surface. So making sure if we're starting to walk again and we haven't been walking as much outside, that you're picking an area that doesn't have a lot of uneven surfaces. If maybe you aren't used to walking on, a ton of dirt and gravel, you want to start with a nice flat surface. In Florida, we want to make sure we're doing early morning or evening walks, although today is pretty nice to do a nice afternoon walk, and that we're drinking plenty of water, and also allowing a warm up and cool down before and after your workout can be helpful. So we talked a little bit about how to determine whether you're power walking, reaching that 150 minutes of power walking is something that you can do. So how do we determine exertion? So if you're thinking, maybe I'm not walking fast enough and I need to improve my pace, you really should be trying to shoot for moderate intensity aerobic exercise if you've been sedentary after treatment. So that would be looking at this scale of perceived exertion. You want to be somewhere in that 12 to 13 range. So in between light and somewhat hard. You shouldn't be able to have a full conversation, but your heart rate shouldn't be beating out of your chest. You shouldn't be having trouble, with the rest of your day, completing your other tasks. It should be kind of right in that middle, moderate intensity exertion on this scale. Here's just some examples of what we go over in SOAR. Like Diane talked about, we do a wonderful segment on exercise and survivorship, and we actually do an exercise class, which is always so fun. I feel like Richard Simmons sometimes doing some of these exercises and trying to encourage people to start this as part of their program. So just simple things like taking a resistance band and doing some upper body stretches are things that we go over in SOAR, and these are some examples of those that we go over in our survivorship program and also in outpatient rehab. And here's just some more examples of balance exercises that we would go over as well. So it's not always about just working your upper body. We want you working your lower body as well. And just to close out, one of my favorite quotes from Nicole Stout, who is a great PT in the field. We used to tell women never to lift 5 pounds or 10 pounds for the rest of their lives. That's absolutely not true. Women should be using their arms and exercising, but in a wise way. There is danger in exercise if you overdo it and strain the limb, but I've never told a patient you can't do that. Whether you want to try yoga for the first time, get back on the golf course, go rock climbing, or even return to powerlifting. It's a matter of working the limb gradually, exercising it to get in shape to do those activities. So starting slow and working your way up. So thank you so much. We're happy to take any questions that you have. And just want to say thank you guys so much for being with us and listening. It's one of both Diane and I's great passions in life and what we love to talk about. So we do hope that you enjoyed it, and we take a lot of pride in trying to. Oh, Angela says, don't have any questions. Just wanted to thank you for having this today. You are so welcome. We take great pride in kind of giving this information and take a lot of honor in kind of walking this walk with people. So thank you for being here.
Thank you.